Well, good evening. I think we'll go ahead and begin our program this evening. Dean Griffin is just having a little difficulty with Zoom this evening, and we're going to patch Dean Griffin in just as soon as we possibly can. But I'll jump in. David Holtgrave, Dean of the School of Public Health, and as always on these Monday evening town halls, we're so excited when the students, faculty, staff of CEHC, School of Public Health, and a number of other schools and colleges across the university can join together for these important discussions about COVID-19 and the progress that's being made, and so many of you are contributing to on the front lines. We have a very special program this evening with various team guests from Shanghai General Hospital. So I will only take a moment in my opening comments to say that it's a relatively good news week of progress in New York State. 2 weeks ago, I said we were in 700 or so deaths per day, about a death every 2 minutes. Those are down into the 300s per day now, still far too many, and every loss is to be mourned. But there's progress in the fatality statistics moving forward. Also, if we look for New York State at calculations of the reproductive rate, the Department of Health, in partnership with the School of Public Health at UAlbany and Dr. Eli Rosenberg in particular, have been calculating the reproductive rate for New York State. And it's now in the 0.8 to 0.9 range, which means we're starting to dip below 1.0, which is good sign, and that we're beginning to shrink a bit the number of new cases it would appear at this point, but we still have a long way to go. And in terms of antibody testing in the state, the first results of statewide antibody serosurvey has been released at about 14.9% of persons tested have antibodies for COVID-19. And of course, remains the question of how much immunity those antibodies provide and for how long. But it gives us a sense of sort of the prevalence. And it's over 20% in New York City and about 3.5% upstate, and here in the Hudson Valley around 10%. So we'll hear much more about the serosurveys in the weeks ahead. And also just a study that a number of us have been working on lately, the study of hydroxychloroquine, azithromycin, and so on, has been preliminarily discussed in the media in the past week. The governor said on a CNN town hall that it appeared that there wasn't much of an effect, and that is correct. In the first 600 or so records that we examined, there didn't seem to be a benefit of hydroxychloroquine. No statistically significant benefit or harm once we accounted for things like the illness of patients upon admission. This week we should be finalizing that study, and hopefully next week or so, or maybe the following week, when we talk in our town hall, I can give the final results of where we're at. But I just wanted to mention the preliminary results that were discussed in the media over the last week. And now it's my really great pleasure to move the program to our discussion with our very honored and esteemed guest from Shanghai General Hospital. We're so pleased that they have been willing to join us this evening. And to do the formal introduction, I'd like to turn the program over now to John Justino. John is the director of our Center for Global Health. He's worked across the globe for many years, making tremendous contributions on the front lines of public health, including a great deal of work that he has done in partnership with colleagues from China. We're deeply honored that our guests are here with us tonight from China. And also, I'm very pleased to introduce now John Justino, Director of the Center for Global Health. John, I'll turn it to you.
Thank you so much, Dean Holtgrave. Our Center for Global Health is pleased to be a part of tonight's special town hall meeting, and I'm delighted to have the honor of introducing our invited guest panelists from Shanghai General Hospital. As the Dean said, we are very grateful that these busy doctors have agreed to take the time to join us for this week's virtual town hall and to share with us some of their recent experiences supporting the COVID-19 response in China, both in Wuhan, where the outbreak is believed to have started, and in Shanghai, one of the most densely populated cities in the world, with a population of over 25 million people. We are also very pleased to see that we are joined this evening by a number of clinicians from our many regional hospitals here in the capital region of New York State. Our panelists include first Professor Ruilan Wang, Dr. Wang serves as the director of the Emergency and Critical Care Department at Shanghai General Hospital and teaches at the Clinical Medical School of Shanghai General. Her research interests focus on the treatment of critical diseases, including severe pneumonia, sepsis, and multiple organ dysfunction syndrome. During her recent deployment to Wuhan, Dr. Huang worked in the intensive care unit in the Wuhan 3rd Hospital, playing a leadership role in the development of treatment plans for critical patients with COVID-19. Also on our panel is Dr. Hui Xie. Dr. Xie is the Associate Chief Physician of Emergency and Critical Care at Shanghai General Hospital. His current research interests include the study of lung fibrosis and medical conditions resulting from exposure to toxic herbicides. During the COVID-19 response in China, Dr. Xie was assigned to the intensive care unit at the Shanghai Public Health Clinical Center, designated as a specialized hospital for COVID-19 patients in Shanghai. Our third panelist is Dr. Qi Su. Dr. Su is an attending physician of emergency and critical care medicine at Shanghai General Hospital. His research focus is on severe pneumonia, acute respiratory distress syndrome, ventilator-assisted treatment, and sepsis. As part of the response to COVID-19 in China, Dr. Su has been working on the development of a new nosocomial infection or hospital-acquired infection control system. In addition, he was assigned to treat patients in the Department of Severe Infection at the Wuhan Thunder God Mountain Hospital, a new 1,000-bed infectious disease hospital, which was constructed in just 10 days, which is an amazing accomplishment. Before turning things over to Dr. Huang, our colleagues from Shanghai asked me to mention that while perhaps not appropriate for this evening's virtual town hall, they are very eager to participate in other more technical exchanges with clinicians working on COVID-19 here in our capital region and across New York State. So with that said, let me welcome our guest panelists from Shanghai General Hospital. We look forward to your brief presentation and to an engaging question and answer session.
Thanks, John, for your introduction. Good evening. It's my great honor to be here to share our experience about anti-COVID-19. I'm Dr. Wang from Shanghai General Hospital. I went to Wuhan 3rd Hospital. I'm glad to introduce my colleagues. Dr. Su went to Wuhan Leisenshan Hospital, and Dr. Xie went to Shanghai Public Health Clinic Center. It is the only designated hospital to treat the confirmed cases. All of us work in the ICU from Shanghai General Hospital. I will talk a little about my hospital. Shanghai General Hospital was founded in 1864. It is a big teaching hospital with 2,300 patient beds and 4,000 employees. Now I will introduce the review of the outbreak in Wuhan. On January 23, Wuhan lockdown. Since the patient increased quickly, very shortage of healthcare workers. So 40,000 medical workers from all over the country volunteered to Wuhan to support the work of Wuhan colleagues. Government quickly established 3 temporary hospitals. Leisenshan and Hoshenshan Hospital treat critical care patients. Mobile cabin hospital was mainly for the mild patients. The aim is to prevent the infectious patients from gathering and spreading in the community. Until February 19, the new confirmed cases dropped under 1,000 per day. On March 10th, mobile cabin hospital closed. And on March 12, new cases decreased under 10 each day. So medical team started withdraw from Wuhan. Shanghai is a large city. Here has a rich medical resources. So 1,649 health staff from 89 Shanghai hospitals support Wuhan. The medical teams work in Wuhan 17 hospitals. Team members including respiratory and critical care doctors, multiple disciplinary doctors, nurses, and professional psychologists, clinical lab test doctors, and hospital infection control doctors also have quality control doctors. So far, we cannot fully understand the disease, but we observe some characteristics of these patients. We found all ages are susceptible population. High-risk factors include hypertension, diabetes, cardiovascular disease, and about 10 to 20% of patients develop the critical stage around 7 to 10 days. The main manifestations are dry cough, fever. Some patients present with weakness, diarrhea, dyspnea, and some patients loss of smell. We also found a high prevalence of family cluster, and medical staff have a high morbidity rate. We also found in children, pregnant women, and very old patients, over 90 patients have a low mortality. So at the beginning, our goal is reduce patients' mortality rate and control zero infection of medical staff. According to the infection guideline, all of the staffs need to wear the level 3 PPE to enter the ward. We stay in ICU for at least 6 hours or more longer per day. If the patient is unstable, when we left the ward, sometimes feel exhausted. So before entering the ward, professional staff will give you one-day training about wearing and taking off PPE. Professional staff also assist the exhausted medical staff to safely remove PPE in the semi-polluted area. I will introduce how to screen suspected cases in the hospital. There are 117 fever clinics in Shanghai. Fever patients see the doctors in the fever clinics, not in the emergency room. Doctors, according to patients' contact history and the symptoms, did the nucleic acid test, blood count, and the CT scan. If the patient's PCR positive, just transfer to the designated hospital. If the patient's PCR negative and his CT scan have problem, just observe in the fever clinic and reset the nucleic acid again. Now, Dr. Xie will sharing his experience in Shanghai, please.
Good evening, everyone. And it's my honor to have this opportunity to introduce how Shanghai fights against the new coronavirus. Shanghai is a huge city, just like New York City, but there are limited cases in Shanghai. Yesterday, there are about 67 cases left in Shanghai. So I think you are wondering what we did in Shanghai to control and to prevent and control the disease. Our CDC has released a guideline for the citizens to let people know what is the COVID-19 and how it develops and what we do in our daily life and so on. But there are several key measures in it. The first, and I think it is the most important thing, is that everyone should wear the face masks and keep the social distance and take the citywide isolation in order to cut off the transmission route. You know, our country suffered from SARS 18 years ago when Wuhan locked down. And everyone knows that how serious the situation is because we never had locked down such a big city. Since then, everyone began to wear their face masks. And you know, those days are the most important holiday for our Chinese, the Spring Festival. Just like the Christmas days, we get used to visit our friends and families. But this time, everyone stay at home and go nowhere. And here is a picture of the most famous spot in Shanghai. And you can see there's no one, there's nobody there. The second thing is to control the source of the infection. Shanghai has set many checkpoints on the highway, in the airport, in the community, in the public transportation station to screen the suspect source of the infection. We also use mobile apps like WeChat, Alipay to detect whether you have been to the hotspot in the last 2 weeks and for the contact tracing. When you get on the train, get on the taxi, get on a bus, get on subway, there's also the QR code for you to scan to record your trip online. And now let me introduce the Shanghai mode for critical patients. Shanghai integrates the medical resources into from virus hospitals into the designated hospitals, Shanghai Public Health Clinic Center, including doctors, nurses, and equipment like ECMO machines, ventilators. The medical team were built from the 5 top hospitals, including our hospital, Shanghai General Hospital. Almost all the team members are critical care physicians. I worked as a member of the medical team in the ICU in that hospital for 1.5 months. There are also specialty group to support us, like a respiratory therapy group, ECMO group, renal replacement therapy group, hospital infection control group. We also have the psychiatrists. They are not taking care of the patients, but also focus on the mental health of our doctors and nurses. And in order to protect ourselves in the invasive operation, like ECMO intubation and tracheotomy, all the medical staff should wear the positive pressure cover. Besides that, the operator should wear the gloves and get on another pair of, should wear the scraps and get on another pair of gloves. Of course, it is much more difficult to do the operations than usual, but all the operators have good skills. They did a good job. And also, you know, the COVID-19 is a totally new disease. We do not know much about it in the beginning. And when we understand the disease step by step, the prevention and the control measures should be updated in time. Here is a small example. When we get to know that we can detect the virus in the stool sample, it means that people may get infected through the fecal. So that may be the new transmission route. We develop a detailed procedures for the medical staff to use the toilet. And now let Dr. Su share his experience in Wuhan Leishanshan Hospital.
Good evening, everyone. First, I should say, don't be afraid and don't be careless. Now, I will share my experiences in Wuhan Leishanshan Hospital. How to protect the medical staff. As all we know, physical examination is very important for COVID-19 patients, but it's also very dangerous for doctors. So we invented a wireless stethoscope. Use this, we can collect the sounds of heartbeats and breath sounds and transmit them to the mobile phone of the doctors. For example, this is the sound This is a breath sound recorded by the nasal scope. Let's listen to it. Vapor rills is a abnormal breath sound, defined as small cracks, soft and short duration. We found that this kind of sound can be heard more often in patients with severe COVID-19, and the prognosis is extremely poor. Another dangerous operation is pharyngeal swab collection, because it can generate droplets. We invented a device. Listen to the picture. Look at the picture. There is a piece of glass. On it, there are 2 operation holes. We can collect pharyngeal swab through this holes. It can reduce the generation of droplets. This is another invention, a multi-channel protect cover. Look at the picture. On the cover, there are 8 operation holes. We can operate through these holes. There is my nurse performing the perfume section. Close the perfume section in the cover. Reduce the production of droplets and alcohol. Also, this protective cover can be also used for all the infectious operations, such as tracheal intubation, bronchoscope, and so on. Okay.
Now, all medical staff will come back home, and we held a big ceremony in my hospital. All of us feel very excited, but however, you can see we still feel face masks. As you can see from this, the pandemic situation in China has been stabilized. According to the latest data, the confirmed cases in Wuhan dropped to 0. And there are 67 remaining cases in Shanghai, but most of them are imported cases. As you can see from these 4 pictures, people are getting back to their normal life. Schools and tourist actions gradually reopen. The upright picture was taken recently at the pond, one of the most famous landmarks in Shanghai. So welcome to Shanghai, see the Wang. Drawing from our experience, we believe that this pandemic can be defeated if the public continue to practice social distancing and take precautionary measures like wearing masks. Hospitals continue to screen suspected cases straight and prevent cross-infection. I firmly believe that situation in New York City will also get stabilized in the near future. Thank you very much.
Thank you, everybody. And this is Bob Griffin, and Dean of the College of Emergency Preparedness, Homeland Security, and Cybersecurity. I apologize for being late. Some minor technical difficulties, but we overcame it. Thank you for that presentation. I'd like to remind everybody in the audience that questions and can be posted in the Q&A section, which is located on your Zoom bar. With that said, why don't we jump into the questions, and I'm going to ask Vice Dean Goodall to toss the first question out.
Thank you. So our first question is regarding the low mortality rate among elder population over the age of 90. Can you speak more about that?
Okay. In my setting, we treat the oldest lady as 103. So this lady just PCR positive, but have no symptoms, no pneumonia. So because why the lady stay in the ICU, because she suffer from the heart disease, uterine disease. So in the ICU have a more monitor. Through 10 days stay in the ICU, she recovered very quickly, so back home. And so in my setting, we also see another about 5 old people, still no symptom, just PCR positive.
Thank you. Our next question, it is clear that you had tremendous success protecting the medical staff responding to the crisis in Wuhan. Do you have plans or ideas for how the lessons learned and new techniques developed can be shared with clinicians all around the world facing their own crises?
Yeah. Thank you. You mean the just protection or just therapy? Big pardon? You mean?
I'm sorry. Can you repeat repeat your question?
Yeah, I mean, from the Wuhan, we learn from the just protection or just therapy. Would you like to?
Yeah, either. I mean, you talked about you know, both the protection and the therapies. How are you going to share that? Do you have plans to share that?
Okay, thank you. Thank you. At the beginning, when I went to Wuhan at the early stage, because a lot of very severe patients, so all of the medical staff just want to how to saving the patients. You know, we have no specific drugs, no antivirus drugs, so we treat all of the patients. Just the first symptom is oxygen therapy, and we make plan how to treat that kind of very severe patients. So I think the oxygen therapy is the first thing. It's a very important thing, and we also the organ support therapy is also very important, and for the lot of doctors and nurses feel scared at the beginning. So we have in Wuhan, all of the team member, if the same team member just live together, we have live the same hotel. So if the doctors or nurses feel very big pressure, so every day the psychologist will talk to you from the online or offline and release the doctors and nurses pressure. You know, this disease we have no more so far we cannot know fully understand the disease. So I think the doctors and nurses have the skill for the disease. So every day we encourage it together. So maybe Dr. Shea can introduce.
I think this time is the mobile internet time. So there are many training courses you can find in the homepage of our hospital. So we can introduce these measures or therapy plan through the website, through the homepage of our hospital. Yeah.
In addition, Wuhan is the hotspot of this epidemic. It implements the most strict control measures, include city shutdown, home isolation, establishment of the designated hospital, national medical staff rescue, and so on.
Yeah, in the mobile cabin hospital, the patients and the doctors establish a very good relationship in order to release the patient's big pressure. The doctors learn with the patients together, seeing and dancing, just release just release the big pressure for the patients. So I think not only the doctors and nurses, and also the patients or every volunteer, every citizen, work together. So it's very important for control the pandemic in Wuhan.
Great, thank you. We also have a series of questions from the audience. The first one, first off, thank you for spending some time with us and sharing your experiences. My question is in terms of clinical response and treatment. How similar has the COVID-19 pandemic been compared to SARS?
Okay, I think SARS a little bit quite different with the SARS. From my opinion, because I'm a frontline clinician, I think SARS induced a very severe respiratory syndrome, but COVID-19 have a little bit quite different. Some patients just suffer from the silent hypoxia, not very typical the ARDS. But SARS, just all the SARS patients suffer from very typical ARDS. So the oxygen therapy quite different. Some patients, maybe we give the oxygen therapy, she can eat, she can no any uncomfortable, but maybe couple of days or just the patient get worse, and eventually we cannot save. So at the beginning, all of the healthcare workers just look for the rule how to treat the patients. You know, we have no specific word, specific drugs. So at this moment, I think oxygen therapy is very important. In Wuhan, maybe a lot of clinical drugs to do the research, but so far we have no specific drugs to control the antivirus. Yeah.
Okay. When the SARS occurs in China, I was still a student in the medical school, so I didn't have any experience about the SARS, but I have read some papers about it. But the COVID-19 is quite different from the other viral pneumonia, and they have different type of respiratory failure. And then because of lack of the specific medicine, the virus could be last for a long time, even for about 1 month. The virus can be positive for 1 month. So we didn't have the specific medicine, so we just do the supportive measures to let the patient, we get time for the patient and let the patient to recover themselves. That's my experience. Yeah.
Did you have any experience?
Okay.
Great, thank you. Can you talk about any experience you had with patients undergoing surgery when positive for COVID?
就是 PCR 阳性的人要做手术的。Yeah.
Oh.
Okay. Because in my setting, all of patients suffer from the COVID-19 patients. So in Wuhan, have another hospital just treat the patients suffer from the need operation patients. So in my setting, because all of the patients suffer from the COVID-19, so I have no more experience for the operation need operation patients.
I have seen some guideline about the surgical department to how to do the procedure in this patients with the positive virus, but they also need the level 3 protection and wear the positive. Everyone should wear the positive pressure cover to do the surgery. And after the surgery, the patient should be sent to the negative pressure room for the monitoring. And that's my experience. Yeah.
I think where the level 3 PPE is very important. You know, we need to save the patient's life. We also need to protect healthcare workers. So in my hospital, so all of the doctors went to the do the procedure need to wear the level 3 PPE. This is very important, I think.
Thank you. Do you believe that if more people in other nations have practices like what Shanghai has, we can be able to return to our daily lives sooner, like what you showed on the last few slides?
Yeah, I think so. I think so. But I think all of the public need to take the precautions measures, such as wear the mask. Maybe we suffer from the SARS days, so all of the citizens would like to wear the mask and contact distance. Yeah.
We know, everyone wants to come back to the normal life, but when to make the decision is quite difficult, because the decision should be made not only depends on one place, but should also depend on the place nearby, because COVID-19 is an extremely contagious disease. So it is very important to get more information, to see the big picture, and then make the decision with great caution. I think it takes about 95 days from Wuhan lockdown to the cases is 0. It takes about 3 months.
Yeah.
We did that job.
It's not very easy.
So I think in the near future, you will soon come back to the normal life. Yeah.
Yes. In one word, don't be afraid, but don't be careless. Yes.
Thank you. Another comment from the audience. Thank you for joining us tonight. We're very grateful. As we're progressing in the state of New York, there is particular interest in understanding that if a person had COVID-19 with antibodies present in the body, do they now have immunity to reinfection? Is that something you found?
有抗体产生了，会不会被感染？
再感染，再次
感染。Yeah, I try to answer this question. In China, we did the test of IgG and IgM. I think if the patient got the IgG antibody, the PCR negative is a good thing. But I don't know whether have the infection for this kind of patients. So far, have no professor make the conclusion this kind of patients whether have the infected again.
Thank you. There's so many good questions. I'm trying to scroll through them. Another question. Here in New York, emergency medical services and emergency departments have seen a decrease in motor vehicle accidents because of people staying home and not driving. Did you also see a reduction of trauma-related calls and motor vehicle accidents in your emergency departments?
Oh, thank you. Because our department include the emergency department and intensive care unit. In Shanghai and in Wuhan, most people just stay home. So just a few car accident. You can see in the Wuhan and the Shanghai, no more people go to the street. But at this time, because the pandemic was stabilized, so just the people went to the street. So the car accident situation is not very severe in Wuhan and in Shanghai. But these days, looks like in my ICU, have 3 patients suffer from the accident. Yeah, but not very much.
Because we are working in the designed hospital or in the Wuhan, so we are isolation. We are not go anywhere, just in the hospital. So we don't know clearly about the accident in that period in our Shanghai General Hospital.
Yeah.
So.
Thank you. At first, we thought people with asthma and cigarette smokers would be at high risk for having a severe case of the disease, but that does not seem to be true. Can you talk about that?
Okay, you answer all. Okay, yeah. In my setting, I just feel
Asthma.
Yeah, asthma patients. I think the high risk factors most are hypertension and diabetes. The asthma patients and COPD patients not usually suffer from the COVID-19. I don't know why. I don't know the mechanism why the patients not usually suffer from the COVID-19.
I have the same situation to my date in the designated hospital in Shanghai, and all the severe patients and almost all the severe patients and the critical patients, they do have the history of asthma and the COPD. That's my date. Yeah.
Based on what we currently know about COVID-19, the selection of therapeutic options through guideline recommended treatment of asthma hasn't been affected. Continuous of inhaled corticosteroid is particularly important for patients already using this medication because there's no evidence of increased risk of COVID-19 morbidity with the use of inhaled corticosteroids and abundance of data showing reduced risk of asthma exacerbation with maintenance of asthma controlled therapy. Yes.
Any questions?
Yeah. Any questions?
Yes, this is David Holtgrave. I want to ask the next question, if I could, please. Your talk was wonderful, and I learned so much. I've taken many notes, so thank you very much for the lessons this evening. I wanted to ask two questions, if I could, please. First, I wanted to ask about the use of fever clinics or fever hospitals. We have read much about how fever clinics were used, and I wonder if you could talk about in more detail how they were used to triage patients, and also if you would recommend that we use fever clinics in the United States. We don't have fever clinics, and I wondered about your experience and advice. And second question, you mentioned the checkpoints during the outbreak, the checkpoints along highways and at the airport and train stations. And I wondered how that screening went at the checkpoints. Were you checking for temperature, for symptoms? What was checked during those checkpoints, and how did you use that information? And again, thank you, and I'll turn it back to you.
Yeah, thank you. Several years before, I started in the NYP in New York. So I know all of the patients, if the patients are very severe, just see the emergency room. But in China, except for the emergency room, we also have fever clinics. Usually we have fever clinics. So all the patients, if the temperature over than 37.3 degrees, just see the fever clinics, because the fever clinics is separated from the emergency room. So in the fever clinics, the doctors will inquire the patient's contact history and the symptoms, such as if the patient have a cough, short of breath, we do the PCR test, and we also do the blood count, and we also do the CT scan. Maybe in America, in New York, CT scan is not very usual, but I think CT scan is very important to earlier diagnosis the patients, especially in the early stage. If the patient gets worse, just do the CT scan. Maybe sometimes it's too late. This disease quite different from the SARS, different from the other virus-induced pneumonia. So in my hospital, most patients at the early stage, we can do the CT scan just for identification whether the patient suffer from this kind of disease. Because lots of PCR negative, how to say?
False negative.
Yeah, false negative. So symptom and the CT scan is also very important for earlier identification this kind of patient.
About the checkpoint, in different periods, the checkpoint has different function. In the first period of the COVID-19, the main purpose of the checkpoint is to detect the patient whether he has fever. The first thing to detect is the temperature. If he has the fever and whether he has been to Wuhan, it's the first period. So if the patient have these two conditions, he will be sent to the fever clinic or sent. If he or she don't have fever, just being to Wuhan, he will be sent to the isolation. And at this period, our goal is to defend the import cases from other countries. So in the airport, we also check the temperature and whether he has been from the hotspot in other country. So when they come back, he will be sent also to the fever clinic or to the isolation. Yeah.
In addition, take attention when you attend the healthy faculty. Wear a mask if possible. Keep at least 1 meter distance from each other, and don't touch the surface with your hand.
Thank you very much.
So we need why we need the fever clinics just screen the suspected source and prevent the infectious patients from spreading. So I think it's very important.
The checkpoint also the main measure to control the source of infection, to find it and to control it.
So isolation the infected patients or normal patients. So I think fever clinics it's very special in China.
This is very helpful advice. Thank you very much. And Dr. Goodall, I'll turn it back to you. I know we have more questions from our audience as well.
We do. Can you speak again of the points of the fecal matter and risk of infection? Was this about the general public or during patient care? Is it still classified as droplet? This has been a question to our medical teams as physical and occupational therapists that are directly helping patients when in their hospital rooms.
As to now, at this time, the fecal transmission has not been proven to be the true transmission route, but we can detect the virus in the stool sample. So to the normal people, I think you don't need to be afraid about this transmission route. But to our medical staff, we touch the patient's stools, we clean for them. So it is important for us, not for the normal people. Yeah.
The disease spread primarily from person to person through small droplets from the nose or mouth, which are expelled when a person with COVID-19 cough, sneeze, or speak. These droplets are relatively heavy, don't travel far, and quickly sink to the ground. People can catch COVID-19 if they breathe in these droplets from a person infected with this virus. This is why it's important to stay at least 1 meter away from others. Yes.
Thank you. Did you see thrombotic events like stroke in young patients without other risk factors other than COVID?
We observe most patients suffer from the D-dimer very, very high.
Thrombosis.
Yeah, thrombosis. From the how to say? And
anemia.
yeah, from the anemia, we can see the thrombosis in the vascular. So in my setting, we saw a lot of patients suffer from the embolism because the D-dimer very, very high. So we always use the heparin to treat this kind of patients. Yeah. Yes, different patient. All of the patients suffer from this same situation.
I don't have the experience about the young patient because all the patients in Shanghai in the ICU are old patients. They are about 60 to 90 years old. Yeah.
But less than 14 years old, the children just a few suffer from the coronavirus. We don't know why have this situation. The young people,
Baby.
The baby and the less than 14 years old children and the very old ladies or very old people. It's not very easy suffer from the severe coronavirus. We don't know why.
Because of the isolation policy, less activity are also one of the reasons. So more activity and more exercise are needed. So.
Thank you. There's a theory that people with blood type A have more severe symptoms and worse outcomes with COVID-19. Is this still a working theory in China?
I don't know her, but I don't know about that. Yeah.
No, I think no evidence.
No evidence for that.
Thank you. Can you talk about your experience with hydrochloroquine?
You can ask,
experience in the ICU and of the Deans Hospital in Shanghai, we used hydroxychloroquine for the severe and critical patients. But in my experience, I have take care about 3 to 4 patients. There are 2 patients. They are virus positive for a long time, about 30 to 40 days. We also use the chloroquine, but in these 2 patients, the virus didn't become negative after use the drugs, but they have side effects. The white blood cell count and the platelets dropped after we gave the patients the drugs. So we stopped the drugs and do nothing because maybe this is not the therapeutic medicine, specific medicine. Yeah. This is my experience.
So far, I have no more experience for this kind of these drugs. I just use less than 10 patients. All of the data shows that no more evidence to support these drugs is useful for the COVID-19. We need more evidence, I think.
The study should be designed. It should be good design, and the sample size should be big, and we should do many things to prove its effect. To prove it. Yeah.
Thank you. We're just about at time, but if we can just squeeze in one more question. Can you talk about how the pandemic was experienced and handled in rural areas?
Oh, okay. In my country, rural situation is better than the city. because the population is not how to say, it's not so much. So yeah.
And as I know from the social media, because we are living in the city, and we learn this information from social media, and the rural government have strict measures for isolation to isolate the patients. So they don't let people get out and come in, and that's why they control the disease.
Still stay at home.
Yes.
Yeah, it's very
Very strict.
Yeah, very strict.
Okay.
Thank you so much. We are at time. We really appreciate all of your information. For clinicians in the audience who are seeking additional feedback or have questions, Dean Holtgrave, who's the best contact person?
I think the best would be Dr. Gu from Wadsworth Laboratories. And if you would like to make a connection, please feel free to email myself or John Justino, and we'll make sure that we get everyone together. And again, I'll add my thanks. It's really been a great evening. And Dean Griffin, back to you.
Thank you so much. As we've been talking about, this is a global pandemic. And I hope that everybody took to heart the same issues that we're facing here in the United States being faced by all of our global partners, including those in China. Thank you to the panelists for being here. Again, thank you for Dean Holtgrave for your continued incredible work on behalf of the University of Albany and also on behalf of the state of New York. Remember, hate the virus, love the people.
Yeah.
Bob Griffin, saying good night.
I would like to thank the organs. Yeah. I would like to thank the organs of the town hall meeting, Dean Green and Dean Holtgrave, and the Center of Global Health or School of Public Health for giving us this great opportunity to share our experience with your colleagues in your state. Thank you so much.
Thank you so much.
Thank you.
And have a great evening. Be safe, everybody.
Yeah, be safe. Be safe. Hope everything going well.
I'm sure you will go through this terrible period in the near future. Yeah.
Thank you.
Thank you so much, everyone.
Thank you.